Good morning, my people. Let me start by welcoming you back to my YouTube channel. And I always appreciate you people for supporting this channel, because if it were not for you, this channel could not be where it is at the moment. We are still looking about kidney failure, which has been one of the most important topics, and a topic that majority of you guys have requested me to discuss it. And I do appreciate, because many people are appreciating what they are getting from this topic. And before we continue, if you are watching this channel for the first time, just take a second or two and click the subscription button. Then make sure you put the notification bell on, so that whenever I upload a video like this, YouTube will automatically notify you and you'll never miss any of our topics. And for the returning subscribers, I do appreciate you guys, because it's all because of your support that this channel is growing bigger and bigger each day. Today we'll be looking about kidney failure outlook. Kidney failure outlook. It's not always possible to know precisely how long a person with kidney failure will live, as it can depend on many factors, including the following. It's not always possible to know precisely how long a person who is suffering from kidney failure, he or she will live. You can't tell. He or she will live for 2 years, 3 years, 10 years. It's not always easier to predict or to tell, but it majorly depends on some factors which we are going to discuss or to name them below. If somebody asks you, for instance, you get kidney failure, how many years will you live? How are you going to answer this? So, the amount of time, the years you will live, will depend on the following. Number one, the underlying cause. What is the cause of your present condition? What is the cause of your kidney failure? Because each one has a different cause from the other. Number two, how will that underlying cause be managed? How will that underlying cause be managed? And how fast is it going to be managed? And how well is it going to be managed? Number three, any complicating factors like high blood pressure or diabetes. Remember, when we were starting to discuss this topic, we said the major contributing factors to kidney failure are diabetes and high blood pressure. So this will be always a factor to determine how long you are going to live when having kidney failure. So any complicating factors like diabetes or high blood pressure. Number four, the stage of kidney disease at diagnosis. This is because Some people can be diagnosed at the first stage, other people at the second stage, others at third stage, others at fourth stage, and others at fifth stage. So depending on the stage, because the severity depends on the stage, depending on the stage, this will always be a factor. Because, for example, if kidney failure is diagnosed as stage 1, it's easier to manage or to heal than when it is at stage 5. That's why we are saying the stage of kidney disease at the time of diagnosis is a major factor. Number 5, we have age. And how does age come in here? When you are young, or comparing somebody who is young and another person who is elderly, the healing process in the young person is too fast compared to the elderly. A point to note. Now this is very important. National Kidney Foundation. National Kidney Foundation says that a person on dialysis can expect to live for an average. Get this clearly. National Kidney Foundation says that a person on dialysis, and I hope you understand what dialysis is, a person on dialysis can expect to live for an average of 5 to 10 years as long as they follow their treatment. Let me repeat this again. National Kidney Foundation says that a person on dialysis can expect to live for an average of 5 to 10 years as long as they follow their treatment. So if you are on dialysis and you follow it the way it should be, you can live for 5 to 10 years. Some people live more than 20 to 30 years. Some people live more than 20 or 30 years. Once you reach end-stage kidney failure or stage 5, once you reach end-stage kidney failure, you will need dialysis or a kidney transplant to live. Once you reach end-stage kidney failure, that means the kidneys have completely failed. You will need dialysis or a kidney transplant to live. Missing even one dialysis treatment, can decrease your life expectancy or the amount of years you are going to live. So you should not skip any of your dialysis treatment. Missing even one dialysis treatment can decrease your life expectancy. Proper treatment and quality lifestyle changes or modifications may improve your outlook, such as avoiding certain foods. Proper treatment and healthy lifestyle changes or lifestyle modifications may improve your outlook, such as avoiding certain foods. Let's look at kidney failure prevention. Oh, how are you going to prevent kidney failure? Kidney failure prevention. You can take steps to lower the risk of kidney failure. You can take a step to lower the risk of kidney failure. Follow directions when taking over-the-counter medications. You can take a step to lower the risk of kidney failure. Follow directions when taking over-the-counter medications. Over-the-counter medications are medications that you just go to a nearby chemist and buy without being prescribed by a healthcare professional or a doctor. So you should take caution when taking such. Taking doses that are too high. Taking doses that are too high, even of common drugs like aspirin, can create high toxin levels quickly. Taking doses that are too high, even of common drugs like aspirin, can create high toxin levels quickly. This can overload your kidneys. Taking doses that are too high, even of common drugs like aspirin, can create high toxin levels in your body. This can overload your kidneys. Many kidney or urinary tract conditions lead to kidney failure without prompt treatment. Many kidney or urinary tract conditions lead to kidney failure without prompt treatment. This marks the end of our discussion today, and I hope those who have requested this topic are actually following each and every bit of our videos, and they are getting what they wanted to learn from this topic. Let's meet in our next discussion tomorrow. Have a successful day ahead.